Good afternoon and welcome. I want to thank everybody for joining us for today's session. As you can see, we have a really great turnout. We're really thrilled that you can, join us today for this webinar, whether you've attended before or this is your first one. We're very glad that you could take the time to be with us today. My name is Denise Corin. I'm the Manager of Communications and Partnerships with the Workers' Compensation Board of Nova Scotia. I'm joined today from the WCB by our Chief Engagement Officer, Shelley Dauphiney, our Director of Psychological Injury, Lynette Fenton, and as well, joining us shortly is Kevin Foster. He's our Manager for Strategy Support and Planning. We're also really pleased to be able to welcome our special guest presenters, Dr. Jackie Kinley, Director of the Mental Health Day Treatment Program at the QEII Health Sciences Centre, and founder of the Atlantic Institute for Resilience, and Louise Trotter, who is the Director of Health, Safety and Wellness at Shannex. I do, before we start, wanted to mention a few housekeeping items. Max, because we're so many, mics will be muted and cameras will be turned off for the duration of today's session. And this is simply to minimize disruptions because we have such a large number. But fear not, we will have a Q&A after the presentation, probably around the 3:40, 3:45 mark, where we'll respond to as many questions as possible in that time. The chat's going to be open for the duration. We're going to be sharing information, important links in there, so keep your eye on the chat. After the webinar, the webinar proper, we've added an additional 15 minutes to the end of the session for some time for industry-focused Q&A. This is now a regular feature of our monthly webinars. It's something we started back in April, and today's focus for that additional Q&A is on the long-term care, home care, and disability support sectors. But of course, everybody is welcome to stay for that session too. To begin, I'm going to hand the mic over to Shelley Dauphiney for some opening remarks, and I'll just do a brief introduction. As I said, Shelley is the WCB's new Chief Engagement Officer, and she leads the WCB teams that advance employer services, prevention, and psychological injury. But Shelley certainly isn't new to the WCB or to workers' compensation leadership. She spent her career in leadership roles across Canada with the Ontario Ministry of Health, the Canadian Red Cross, Pacific Coast University, WorkSafe NB, and she certainly brings a wealth of knowledge to this work and to her role. She sits on various boards. She's a former governor of the Canadian Centre for Rock Health and Safety. She's currently a director with Threads of Life, a member of the Nova Scotia Minister Advisory Committee, and a member of the Executive Leadership Committee of the National Poverty Reduction Initiative. And I'm sorry if I went on too long, Shelley, but I'm happy to turn it over to you.
Thanks, Denise. So that was a lot, kind of a little bit embarrassing too. So let's just stop there. I want to just bring my own warm greetings to everyone today. We have a jam-packed agenda. You don't want to hear from me. You want to hear from people who have the real goods, and I know that. But if you can indulge me just for a few minutes, just want to talk to you a little bit about my new role as the Chief Engagement Officer. So if you take a look, we're just including here a picture of our strategic plan. We're making it very simple. There's 3 things we need to do in Nova Scotia to become one of the best performing boards in Canada. 1, we need to continue to focus on injury prevention. And in fact, we're actually doing pretty well when it comes to injury prevention. We're mid-pack across Canada. We actually exceed boards of our size in terms of the number of lives that we've saved by preventing injuries. So good news to Nova Scotia employers. The second thing that we need to focus on is return to work. And I'm going to circle back to that in a minute because that's the topic of our conversation today. And the third thing is exceptional service. So as part of my new role as the Chief Engagement Officer, as Denise said, I have responsibility for working with you as employers. We know that you felt underserviced. We know that you felt like you haven't had a voice, and that's going to change with this new strategic plan. We know that you are integral in terms of how do we move forward and how do we prevent work disability in Nova Scotia. So that's part of the strategic plan. Part of my portfolio is prevention. Part of my portfolio is engaging with you as employers. And the other piece of my portfolio is to continue to advance psychological safety and the new gradual onset stress legislation that comes into play September 1, and that's why you're all here. Let me just digress for a minute and talk a little bit about why return to work. So if we think about all the things that are happening in Nova Scotia, return to work is an important element. It's an important component of our economy because we need to keep Nova Scotians working. We need to improve the number of people who are contributing to our economy. When I look at other boards across Canada, there's one thing that stands out. It's the fact that Nova Scotians, when they get hurt, stay off work longer, and they're more likely to be off work for life. And we don't need that. And in fact, we don't need to do that at all. We can actually change the narrative around that. All of us working together can learn how to support workers and yourself as employers so that people can stay connected to work and that we can create a system that is not, I guess, as you can say, as expensive. So let me tell you a little bit more about return to work. So today, or in 2023, 1 million days were lost to people who were unable to return to the workplace. 1 million days. What is that? That's like the entire town of Pictou not working. That's not okay. And we have so much we can do to change that. It's one thing if it happens, there's quite another thing that there's actually things that we can do. So today's talk is really about how can we focus on return to work? How can we focus on return to work for those who have a psychological injury? And I want to say that we've brought some of the best in the field to come talk about this. So for months now, we've been working on the launch for September. We've been talking to other jurisdictions. We've been bringing experts into Nova Scotia, and we have some experts here in Nova Scotia who can help us talk about this. And so today, as Denise said, we have Louise Trotter from Shannex, and we have Dr. Jackie Kinley, who's also agreed to come talk a little bit about return to work. So we're going to talk a little bit about building resilience and eliminating stigma in the workplace, because that's really important so that people can actually return to the workplace and feel safe and to continue to work while they have a psychological injury. We're going to share with you what we've learned in terms of best practice approaches for return to work. And that's through our own Lynette Fenton, who's our Director of Psychological Injury. And I know you've heard from her lots in the last few months. This is, in fact, our 6th webinar that we've hosted. We've been front and center, and I just want to say thank you, because every single one of our webinars has been sold out. We increased our size of our webinars to be able to accommodate more people. And in this very instance, we had 1,000 people register for this topic. And we will continue to do this until you as employers say, we've got this. We don't need you to do webinars on this topic anymore. And then we'll switch and we'll find another topic. We're also going to hear from Louise, as I said, on building a psychologically safe workplace at Shannex, followed by questions and answers. And a special thank you to Aware NS and all of our partners from long-term care, healthcare, and the DS sectors, because you've got your special component today. So before much ado, I just want to talk a little bit about Dr. Kinley. So Jackie is going to share with us a little bit about her views from, I guess, a physician's perspective on return to work. And there's a lot I could say about Jackie. Many of you have probably heard her. She's now become a local celebrity, I think, on CBC. They call her, and she talks a lot about different mental health issues. I've heard her many times, and I'm always impressed with the clarity from which she speaks and how she takes complex issues and makes them simple. And I'm really also impressed with the extent to which she has been supportive of all of you as employers, us of WCB, in trying to navigate these waters as we prepare for September. So I was pleased when I called Jackie. She said, sure, I'll come and talk to all of your employers about what it really means to support return to work when people do have a psychological injury. So I am, without further ado, going to turn that right over to Jackie. And as you can see, she's going to take control of the screen and talk to us a little bit about return to work. And for all of our other presenters, I wish you best of luck, and I'm cheering for you because this is going to be a great webinar. The last thing I want to say to some employers who are here, I know that you had asked that we provide a session on third-party investigations. I want you to know that we plan on doing that. This agenda was so full for the month of June around return to work that we made the decision that that will be a component of the July webinar series. Over to you, Jackie.
Okay, thanks so much for having me, Shelley. It's great. Lynette, Louise, Denise, everybody, such a fabulous team. So really, really grateful. And, you know, Shelley, I'm hoping to follow up on what you said about simplifying something that's very complex. But really, I want to boil it all down to sort of stress. So psychological strain and injury at work all comes down to stress and how we respond to the stressors and the demands that we come across at work. So I'm going to give you a high-level overview of how to begin to even think about stress and how we can positively respond and proactively to stress-related injuries. I'm going to introduce a model very briefly that can be helpful. And I'm also going to introduce the role of resilience skills in helping employees not only stay at work, but return to work in a successful way to really set them up to be able to get back to work and stay there. Strengthening mental fitness and building a positive coping skill set is essential in order to help people deal with stress. Louise will introduce later some of the ways that Shannex has done it, including processes to handle things and also some tools. But I'm going to hopefully expand on sort of that. I'm going to introduce this positive and proactive framework, and I'm going to highlight the importance and the necessity of building psychological strength through resilience skills training. So this is the behave model, and when an individual, I'm going to simplify this, when an individual has the resources here on the left-hand side that they need to be able to cope with the demands at work and in life, they do well. They cope positively, and that contributes to engaged workers and psychological health and safety. And the other thing I want to highlight in the middle of this model is it also contributes to sort of a psychologically safe and healthy culture, because when people feel well, they do well. And I want to go back to what I'm sure you guys have heard. We don't have a mental health crisis, we have a coping crisis. People are having a very difficult time dealing with stress. So we're going to touch at the end of this what employers can do, but ensuring that leaders, that employers understand and actively promote psychological safety. They're humans too. They have to embody and practice these things is absolutely essential. And they also need to equip managers with the insights and the resources that they need to promote safety and support people. And that includes assessing employee psychological resources and providing them with training. If you have a good balance between resources and stressors, it has a positive impact not only on psychological safety, but also health and performance. So on the other side of this, when the demands outstrip the resources, what are they? They're job related, workload, things like that. And we're going to talk about, I think Louise uses sort of what are the cognitive behavioral demands, so we have to really outline, what are the demands that individuals are going to be facing. There are system level ones, structure, leadership, technology changes. And I think when it comes to psychological injury, what we're talking about is people-related stressors. Relationships can be hard. And when the demands placed on an individual outstrip their capacity or resources to cope, they don't cope well, and it affects their psychological health, it affects safety and performance. So how does this imbalance between resources and stressors affect people? Too much stress triggers arousal and the body's fight and flight reaction. And that in turn impacts their thoughts, feelings, and behaviors. And again, some of these signs and signals are going to be spoken about later. Said another way, when they aren't adequately resourced to cope with stress, people develop a really rigid, fixed mindset. They become locked in. Their thinking becomes confused, distracted, and distorted in many cases, and their emotions become stirred and agitated and dysregulated, and their relationships become strained. And that's because they become intolerant, they lack empathy, and they have negative changes in behavior that lead to conflicts, harm, and injury. So resourcing people is really important, not only to keep them safe, but to also make sure that they themselves don't become psychosocial hazards. And these reactions are natural and normal. When people don't feel well, they don't do well. Again, not a coping crisis, a behavioral sorry, not a mental health crisis, a behavioral health crisis. It's a coping crisis. There are two ways this can go. We can ensure on the left-hand side here a virtuous cycle that workers have the capacity, the resources to positively cope with stress or demands in their workplace, or not, right? If we don't, we'll end up in this vicious cycle. And employers' actions will determine which direction we take. And it's important, really, that in order for this virtuous, cycle to sort of happen, we need resources, because if we don't have them, it directly impacts individuals and teams' ability to cope. So workers not only have to have access to the resources to deal with the demands at work, they need the psychological skills to effectively deal with workplaces. And that's where resilience comes in. It is a set of skills. They can be assessed, and they can be learned, and they can be trained. And it helps people to remain positive and open-minded, to stay grounded and think clearly, and to contain and work through strong and uncomfortable emotions, and to get along with other people under stress. With training, you can actually strengthen people's capacity to deal with stress. Just like physical fitness, mental fitness contributes to better health and performance. I will very briefly put on my doctor's hat. I know this is a very busy slide, but I will start at the top. We know that employees and workers are feeling stressed, and we know that we need to build mental fitness, and we need to do it now. But there are also times when it's required more urgently. Timing matters, especially when people are at risk. So, at the top right-hand, sort of side here, this is where the vicious cycle can take place. The warning signs, we'll talk about the spectrum, the continuum. When people don't feel well, it changes their behavior, the way they think, feel, and act, and you end up with performance issues. This is the invisible top right. Nobody sees this area. Nobody talks about this area, and it's growing. And so identifying symptoms, in my mind, is too late, and because they're already in a medical framework. And we know that there's excessive caseloads, and managers are overwhelmed, all levels of the system, and psychiatrists are also stretched. And it's important for you to know that they're trained to identify illness, not to help patients develop functional skills. And they're not very good at understanding the demands that people are under at work. And so, as you'll see shortly, that's reflected in the types of notes that you receive from doctors. So demands and resources need to align. On the top left-hand side, like Shelley was saying, we need to get people back to work. We need to get them back to work faster. The sooner, the better. It used to be when you had knee surgery and you were laid up for you were laid up for a month. Now we know you need to get people back on track. You need to get them moving and using those muscles fast, and your brain is no different. However, when people return to work and their symptoms are better, they still don't have the skills they need to demand with the stress to deal with the stressors and the demands that put them off in the first place. So successfully getting back to work means that individuals need to learn how to deal with stress and stressors. Some of those stressors are under their control, some aren't, but they need to be able to cope with the situations that are. People aren't successfully getting back to work for two reasons. The hazards that put them off are still present, or they haven't been properly resourced with the skills they need to deal with the demands of their work. So they're not making it out on this left side. And just identifying the problem isn't enough. You have to train them. And learning is context context dependent, meaning they learn these skills in the workplace. You don't recover to return to work, you return to work to recover. The workplace is the perfect arena in which they can practice and apply their skills. Just like physical fitness, you practice in the gym and you use the skills when you play the game in the gym. It's exactly the same thing. Workers need to get back to work on time. They need to get back into the game. The sooner the better. If they do have to leave the game, then we can take care of them, but we need to get them back fast. So I think I'm going to I have one last thing I was going to say, and that's in order to sort of stop the cycle, to reduce stigma. We need to give people a safe space to be able to talk about things. And that means we need a positive and proactive framework. And that includes destigmatizing language, okay, and normalizing language, okay? We all don't do well under stress, and we can all get ill. It isn't a character flaw, it's a skills deficit. Okay, and leaders need to be psychologically safe, and managers need to be properly resourced with the education and the tools that are going to help them. And we need to provide the positive, proactive support. So we need to assess functional ability, functional skills at a psychological level, just like we do physical assessments. And we do that under stress. And we need to give people the skills that they need to be able to get back to work. Timing matters, okay? Language matters, and recognizing those at risk is really, really important so we can get at them early.
Thank you, Jackie. That was a great summary. Many years of work have gone into 6 simple slides talking a little bit about the coping problem that you said we're facing. I know that I'm monitoring the chat here, and thank you, Karen, our own CEO, is here rolling up her sleeves and really pointing out some of those key points that you just made about the importance of recovery at work. So thank you so much. And now we can actually make a great segue as we turn over and talk a little bit more about some of the nuts and bolts of return to work. And we ask Lynette Fenton to join us. And for all of you who Lynette gets settled there, Jackie and Lynette, and even Kevin Foster, who's been here many times talking about our policy, are all available at the end for questions and any further conversation on any topic that you choose. So Lynette, happy to hear from you as well. Over to you.
Thanks, Shelley. So in my role as Director of Psychological Injury at the WCB, I lead both our gradual onset and our traumatic psychological injury service delivery teams. And while our traumatic injury team has been in place for several years, after the GPI, or gradual onset psychological injury legislation, was passed last fall, we started recruiting a new team for our GPI area of business. It took a while to get the experience and expertise that we need, but I'm really pleased to be able to say that today we have the majority of the team in place and engaged in very comprehensive training leading up to September the 1st. Providing expert, effective support for return to work is a major part of their preparation. As Shelley mentioned in her opening, the WCB service model for gradual onset psychological injury is different. It incorporates new approaches and new roles, and it's not the same as our current service model for physical injury. That means starting in September, employers are going to have both a physical and a psychological injury claim experience that will be different between those two areas. That difference is by design. So GPI presented us with an opportunity to think differently about how we could support workers and employers through the claim process and to incorporate the best practice approaches that are working in other jurisdictions across the country, and some that we have incorporated ourselves from that are brand new to us and new for them too. So we're going to apply these new processes for GPI, and we'll watch closely to see which work best, and then consider how we might expand them across all injury claims in the future. Today's webinar is going to offer an in-depth look at return to work after gradual onset psychological injury. But before we dig in, I want to take a quick moment to back up a step to refresh everyone on what GPI is and the service model that will guide our service for it. So, gradual onset psychological injury. What is it? What is it not? You may have noticed that we use the terminology gradual onset psychological injury rather than gradual onset stress. This is very intentional because we know stress is very common. We all experience some level of job stress, and that's normal. The day-to-day stress of work, missed deadlines, our job is hard, or we don't like our job maybe, I've got new things to learn and I don't like it. Those are not generally what we are talking about when we talk about gradual onset psychological injury. This legislation and our policy that supports it are clear. It's right in the legislation. What we're talking about with GPI is significant work-related stressors. It is not about liking or getting along with people, and it's not about not liking what you do. For the most part, that will mean psychological injuries caused by bullying and harassment. Not always, but often. This is about serious, significant, major stressors that happen repeatedly and that cause these injuries. So we're talking about the big stuff here, not the day-to-day stress of work and of life, and we really want to be clear about that. This is probably one of the biggest questions that we get asked, and we just want to really continue to share the message of what it is and what it is not. I also want to emphasize that our service model for GPI is informed by you. You told us what you need from us, and we're responding to that. Here you'll see some of the quotes that we've heard from folks, and we want it to be responsive as we talked about, as we looked at our model opportunity and how we could do things differently. So we listened and we tried our best to incorporate a new model that will implement levels of service that you employers told us we need to provide. So our service model for GPI includes clear service level agreements, knowledgeable decision makers, better access to mental health services, and support to navigate the process so you know what comes next and when. So here's some things that you can expect. Client Care Navigator. This is a new role that we have designed and implemented for this area of our work. The Client Care Navigator guides workers and employers through the claim journey, connecting workers with supports right away, even before the claim is accepted, and exploring recovery at work and return to work opportunities. Our vendor agreements, looking for timely access to mental health services after claim acceptance and timely access to diagnosis if that is necessary in order for us to make a decision on the claim. Focus on recovery and return to work has been built into our contracts. Help identifying limitations to inform recovery at work and return to work and ongoing treatment. A focus on workability. This is about keeping workers connected to the workplace, focusing on what they can do as they recover, and working to remove barriers that inhibit workability. Service level agreements, improving the timeliness of the service we provide and aspects of return to work that WCB controls. So this next segment of our webinar is really intended as a practical conversation about return to work that offers approaches and tools that you can apply as you build and update your plan to support GPI, gradual onset psychological injuries. Return to work is return to work is return to work. When we first started talking about gradual onset psychological injuries, I would have many conversations with employers who were really concerned about how they would approach return to work with psychological injury. And the one thing that we know is there is a lot of commonality and very little difference about how to approach return to work between physical and psychological conditions. So there's a saying in real estate, location, location, location. And when it comes to vocational recovery and return to work, we want to say return to work is return to work is return to work. There's very little difference in returning workers back to work in a workers' compensation system versus non-occupational compensation systems. The only difference is who's paying the bills. The process is the same and the barriers are the same. The individual doesn't change just because they fell off a ladder at work versus falling off one at home. When it comes to medical conditions, the literature is super clear on this. There's very little difference between those musculoskeletal injuries and other conditions or psychological ones. The top predictors of return to work remain the same regardless of condition. When it comes to return to work, we need to stop thinking that the compensation scheme somehow changes how we approach return to work, or somehow the medical condition changes how we approach return to work. The principles of vocational recovery and return to work are universal, applicable in all scenarios, and provide a consistent approach to successful outcomes. That's important because there is a huge economical, social, and human cost to unnecessary work disability. Disability in Canada costs the economy about $60 billion a year. This includes the cost of benefits, premiums, and replacement workers. That works out to about 3.6% of the GDP. For organizations, that can mean 9 to 15% of their payroll, not to mention the indirect costs of lost productivity. Replacement workers are about 70% as productive as the employee who just left on time loss. There are the social costs, the impact on morale in the workplace, lost friends if they don't return to work and are no longer covered by WCB. Where do they go? Often to CPP disability. And who pays for that? Then there are the human costs, impact on marriages, lost financial security, loss of homes. Being out of work is harmful. You are 2 to 3 times more likely to develop comorbid conditions such as diabetes, heart disease, obesity if you are off work. 2 to 3 times more likely to develop mental health conditions such as depression, anxiety, and PTSD is worse by being out of work. And the kicker? You have a 20% increase in mortality, meaning you die sooner. Working is good for us. It is healthy for us, and it helps us recover when we are injured or ill. Being out of work unnecessarily causes harm. We already know the right things to do to manage return to work. But despite doing the right things, most claims take longer to return to work than they should. Shelley talked earlier about the days lost to injury in Nova Scotia, and the fact is our stats are the worst in Canada. Part of that is because the current process relies heavily on medical evidence to enable return to work. There's a belief that if you're not 100% recovered, then you can't or shouldn't go back to work. And that's just not true. I just want you to consider this quote that's here on the screen from Dr. Isabella Schultz. She's a professor of rehabilitation counseling psychology and director of the graduate program in vocational rehabilitation psychology at the University of British Columbia. If a focus on the medical doesn't work, then what does work? If we are not addressing workers' beliefs, perceptions, and expectations, then we are missing a big part of the work disability problem. The academic findings on this issue are clear and indicate that return to work is often less dependent on the medical factors surrounding the actual injury than it is about the unique characteristics of an injured employee and his or her or their employer. Those findings also say that the causes of work disability are multiple, complex, and often distinct from associated health conditions or treatments. What is work disability, you might ask, and why does it matter? So if a worker is unable to be at work or return to work because of an injury or illness, they are considered work disabled. And it matters because finding better ways of handling key non-medical aspects of the process that determines if an injured person will stay at work or return to work will improve outcomes. Until recently, the distinct nature and importance of the stay at work, return to work process has been largely overlooked, Improvements to that process will support better health and function for more individuals, encourage their continuing contribution to society, help control rising costs, and protect the competitive vitality of the Nova Scotia economy. So we felt that the best way to demonstrate some of these principles would be to look at an actual claim scenario. So that's what we're going to do next. So here's a possible injury. Sarah submitted a note from her doctor that says Sarah will be off work for 3 months, and that's all it says. You've heard from Sarah's coworker that Sarah was struggling at work before she went off. She also said that she has been talking to WCB about the situation and is considering submitting a claim for bullying and harassment. That's all the info you have. So here's some questions. So I'm going to kind of do this as a question, and here's some options approach. And these questions are based on questions that we have heard from employers already as we have been doing all of this work. Well, what do I do? There's no information. I have a sick note. They're off work. We have no diagnosis or other medical information, and WCB, you haven't accepted the claim yet. So what I want to say here is you don't need to wait for anything. Your first step is the reach out. Practice compassionate navigation. Check in with Sarah, reach out, see how she's doing, help her to feel supported, help her to stay connected, and talk to Sarah to discuss how stay at work could be possible for her. It's really important to show care and offer assistance. But doesn't this issue belong with HR or WCB? I had a conversation recently with someone who was really, we're having quite the dialogue around where supervisors fall into this scenario. And supervisors play a very critical role in disability prevention. The culture at your workplace will trump all your policies every time. Injured workers perceiving an early negative reaction on the part of their supervisor, maybe they feel like they doubt their injury or they're angry with them when they report what's happened, displayed less commitment to their organization. A negative employer response and lack of employer contact while on disability leave have been cited by several authors as correlations of prolonged disability. Responsiveness of the supervisor is a major determinant in their decision to return to work. So again, supervisors play a critical role in disability prevention, and improving the response of frontline supervisors to employees' work-related health and safety concerns may produce very sustainable reductions in injury claims and disability costs. Very important step. That is in everybody's control. But WCB also has a role, and we are here to be a partner to guide and assist employers with return to work. But ultimately, employers create the recovery at work and return to work opportunity. WCB will be here to support that recovery, to coordinate and monitor the success of required healthcare and the rehabilitation services that will be needed, and to communicate and collaborate and bring all the parties involved together in the return to work planning process, and to help manage and address worker and employer expectations. But the sooner the employer gets involved, the more success you are likely to have. Let's go back to our scenario for a moment. And so you reach out to Sarah and have a discussion about return to work with her. She tells you that she's having trouble focusing, she gets tired easily, she's having difficulty remembering things, and then she gives you a specific example of when the dean told her to do something and she forgot, and then when they passed each other in the hallway, he was upset with her, he wasn't happy, and she doesn't know how she will do in her job or how to make it work. So now what? So it is time at this point to start planning for a return to work now by identifying potential transitional work opportunities in your workplace. And these accommodations are work adjustments to help the worker accomplish what they were hired to do. So focusing on job function, which I believe was one of the things that Dr. Kinley mentioned in what she shared. The essential job functions are generally a what, not a where, when, or how. Those are generally job demands. But working with employees and health service providers to identify the restrictions and limitations, and then the abilities that the person has, and focusing on those abilities is a really great place to start. And while right now these injuries aren't compensable, and they will be in September, it doesn't mean that you don't have employees who are also already looking at these accommodations. And so looking through your jobs and identifying potential transitional work is a really great first step. I want to mention a couple of excellent tools that we feel can support return to work success in your workplace. So the first is the JDAP tool, and that's the Job Demands and Accommodation Planning tool for organizations. And this has been designed to provide workplaces and others who support workers with practical support and accommodation ideas that are relevant to specific job demands. It was developed and tested by research experts and people living with disabilities, community groups, and workplace organizations. And the JDAP is different from some other tools in that it focuses on work demands rather than health symptoms or diagnosis. It uses a series of simple questions to identify areas of work that may be challenging for a worker, and it provides a list of concrete support ideas relevant to the job and the worker's needs. There are two versions of the JDAP for organizations, one to support a specific worker and the other to explore supports that may be helpful for a specific job. So this can be a really good tool for you to start looking at as you're thinking about the jobs that you have at your place of employment. And it's a really great tool for individuals as well, as it will help them walk through a set of questions to think about accommodation options as they are struggling with different things in their work. The second tool here is the new Return to Work Toolkit for GPI that we just released this week. This is a comprehensive guide to return to work after gradual onset psychological injury that we feel confident will help you get comfortable talking to workers about mental health, challenges in your workplace, enable you to recognize the signs and symptoms of mental health issues, teach you how to assess the accommodation needs of a worker, show you how to develop accommodation strategies, and help you develop return to work strategies for employees and take a leave and those who take a leave of absence due to mental health issues. The toolkit is pinned in the webinar chat, and I'd encourage you to copy the link and take a look after this webinar is over. But if you don't have a chance to do that today, it will be available anytime at workingtowell.ca. So let's quickly get back to Sarah. So you've received an update from Sarah, and she's able to return to work, and the healthcare provider has noted she needs a 20% reduction in her workload. So another question we get, well, what are some features of a good return to work plan for Sarah, and what are some bad examples? So here we have a better and a bad and a better approach to a return to work. So bad return to work plans really don't have any tight deadlines. They're left very ambiguous. They can just, instead of having a defined plan, it's just suggestions, as you can see here. But you can address these by making incremental steps a part of your plan. You can add deadlines a few weeks in, gradually adjust the start time, and slowly reintroduce public interaction, slowly add business critical work back into the workload. Something as simple as, instead of starting later in the day, it's moving back to 9 a.m. at the 3-week mark. It provides specific incremental steps with a beginning and ending time frame so that people have a good expectation of what they can expect. Successful return to work plans address and build tolerance. They feel doable. They have ability to adjust and maneuver, remove uncertainty, reassure, address concerns, reinforce positive expectations, logical progression, and start and end dates, as I just said. It's really important that they focus on the abilities, considering the restrictions and limitations, but really focusing on abilities. Our final question, how do I support Sarah when she returns to work? Meet with her on her first day. Update her on any changes that have taken place. And you can ask questions like, what questions do you have about return to work? What concerns do you have about coming back? Is there anything else that you think needs to happen so that you are successfully returning to work? Stay in touch, being connected. Common themes that we keep hearing, but so important to successful return to work and stay at work programs. So final takeaways here. I'm not going to read through this whole list because I'm very cognizant of how much time we have is passing here, but this is a really good example of a checklist for return to work planning, and you'll be able to continue to look at this information when it's also posted on our website afterwards. At this time, I want to introduce to you Louise Trotter. And so we thought it would be really important to invite someone, an employer who's currently working through this and how they are preparing. And so Louise is not a stranger to many of you. She's an accomplished occupational health and safety professional with over 27 years of experience helping workplaces build effective health and safety programs. Her expertise lies in bridging the gap between compliance with legislative requirements and practical safety programs for organizations. She specializes in the interpretation of applicable safety regulations and translating them into actionable strategies to drive improvements in employee safety and well-being. Louise's experience includes serving as a safety officer at Stantec and as safety officer for a Toronto area school board. She also served as manager of health and safety for the Peel District School Board. She was once a relationship manager here at our very own WCB NS, and she is currently the director of health, safety, and wellness for Shannex. So welcome, Louise, and we look forward to hearing what you have to share with us.
Thank you so much. And hello, everybody. Good afternoon. And thank you so much, WCB, for having me today and to allow me to be part of this conversation. And Dr. Kinley for really setting us up at the beginning and reinforcing why this is such an important conversation. So I think, Denise, you're in control of my slide deck there. And you're probably going to hear a lot of what we've already heard. And what I wanted to offer today to employers on the call on this webinar is really a little bit of reassurance. I know we're a little bit nervous about the new legislation. We can see there's a lot of tools and there's been a lot of thought into what this will look like from the WCB, so I'm sure we're going to tap into those. But I think we already have a lot of tools in our respective toolboxes. When it comes to claims for injuries for employees related to mental health, I think we've all been managing these in a non-occupational arena for some time. And the majority of those may stay in that arena because I know we're all going to be diligent in our efforts to address any psychosocial hazards that may exist, like harassment. And so what I wanted to offer was sort of 5 tools or 5 thoughts that we're applying in preparation for September 1. So I wanted to start with incident investigation. No different than any physical injury. Any incident that happens at the workplace, I can't reinforce enough the value of a thorough investigation. For us, we keep it pretty simple. We like the idea of just asking those whys 5 times. And that's really beneficial in order to prevent that reoccurrence. And obviously, when we're talking about the potential for a psychological injury like harassment, we want to make sure we understand why it's happening to make sure we can prevent it from happening again. Number 2, the power of a debrief. This is often underestimated. We assume that post-incident, even if they're minimal impact and everybody seems to be okay, that we don't take the time to do a debrief. I'm going to offer that this doesn't have to be complicated. It's really about taking the time to review what happened, what could be done differently, what would you do the same, and a chance to really check in with people and team members one-on-one. And that check-in is simple as, how are you doing? And being aware of any changes in behaviors that may exist. So be able to address those sooner than later. Number 3, your cognitive behavioral demands. We've talked a lot about those, and you've heard that phrase being used so far in this webinar. So I'm sure for most of us, we have physical demands for all of our positions. I like to offer and suggest that you have a quick look at those and make sure that you also have the complementary cognitive behavioral demands. These are objective demands so we can understand the nature of the position. What does it mean with respect to attention to detail related to the role? Is there distracting stimuli in the work environment? Focus, attention to detail, what do those things mean? So have those prepared for each of your jobs, which will allow you, going into number 4, that when you understand what the demands of the jobs are, then you can sort of fit that with the employee who may have an injury, understand what their restrictions and limitations are. So I think we're all very adept at being able to apply things like how much we can lift or push or pull. So what does that mean when we have a psychological injury? And then how does that relate to the demands of our current role? Understanding both of those aspects really fits in and ties nicely into that return to work plan. So I think we've heard a couple of times that, we return to work to recover. That's a wonderful phrase that we can use, and that there's really no correlation between injury illness diagnosis and the ability to return to work. So using all of that data to return to work. So all of those are a little reactive, that in the event of a claim, what you see now on the slide is being a little bit more proactive. So for us in our experience in managing sort of non-occupational claims for mental health, want to say that there's probably some misnomers about mental health and mental illness. And whereas I'm sure we don't expect somebody with a strained shoulder to be off work indefinitely or to be off at all, we tend to accept or encourage somebody who has a mental injury or illness to be off work. And I think part of that may be related to the fact that we're not as comfortable talking about mental health, and we don't want to make things worse or maybe say the wrong things. And hopefully with conversations like we're having today and the work from Dr. Kinley and WCB, we'll be more adept at those conversations. But for us, in order to do this a little bit more effectively as well, we've embraced the Working Minds program through the Mental Health Commission of Canada. It's a very pragmatic training program, and it's really designed so we can talk about mental health, reduce and eliminate the barriers related to mental health, and learn strategies to stay healthy and hopefully become more resilient. Personally, why I really love this program and this approach is it doesn't approach mental health as one thing or another. It's not a question of being healthy or unhealthy, or at work or not at work. It speaks to the spectrum, and we've talked about this spectrum, I think, right at the beginning, that we are going to fluctuate in how we're feeling physically, our mood, thinking attitude, behavior performance, substance use, and addictive behaviors. And you can see on the slide, you have that arrow moving from green to red, and the arrow moves from both ends, indicating that we can move along that spectrum, and we're never static in how our mental health is. So people may be in that green zone and they may be healthy and coping, but perhaps they're moving into sort of a yellow reacting, having mild or limiting distress, or perhaps more severe persistent injury to permanent injury being in that red zone and being ill, requiring maybe some more interventions. What we know by using this model is the more employees are able to talk about their mental health and approach a colleague about being open-minded and talking about it, the more we can respond. So when we look at this model and, sort of the room in this model where we have that fluctuation, for us, we're really hopeful that if somebody is moving from that yellow phase to that orange phase, that we can intervene. We can intervene as colleagues, we can intervene as supervisors, we can intervene generally as employers to see how we can support that individual in moving back towards the healthier, more coping frame of mind. So for us, that's sort of our path, and hopefully being proactive and in promoting some of the things that we can do as employers to tap into our tools and maybe try some new programs and new conversations as we move to September 1st.
Thank you so much, Louise. And certainly I would say be sure to check out our the extensive resources. Some of them we've posted in the chat today. If you have a question or a comment you'd like to send along to us, although we're going to answer as many as we can today, our gpi@wcb.ns.ca email address is always available. So be sure to send along your questions. We do send out a regular e-newsletter as well, so be sure to sign up for that at Safe and Secure e-news, and the link is there on screen. It's also been posted in the chat. I know that Heather is continually posting our available resources in the chat too, so do scroll through, take a look. The new Return to Work Toolkit for psychological injury is great. I would really encourage you to take a look at that. Our new prevention, psychological injury prevention website that launched earlier this month, also a tremendous resource to make your workplace psychologically safer and to keep up to date on how we're getting ready to serve Nova Scotians for gradual onset psych injury. Our website, wcb.ns.ca/claims and GPI, and you'll find everything you need to know there. And so, I think at this point in our webinar, we're going to move to our questions and answers. And of course, our panel, Lynette, Louise, Dr. Kinley, and I think Kevin Foster is online and available to take your questions. You can answer them in the chat. We're going to do our very best to read them out, ask the appropriate panelists to answer for you, and we'll go from there. And although we're we're getting to be at time, we will answer a few questions now, and then we're going to pivot to questions from the focus sector, which I mentioned off the top, and that of course is long-term care, home care, and disability support. So if you have a question that we haven't been answering along the way here today, and you'd like to answer it in the chat, please do. Again, the topic today, of course, supporting safe and timely return to work after gradual onset psychological injury. And so if you have a question in that regard, please ask, and we'd be happy to answer.
Denise, I know there's a few questions coming in now, but there's something that I noticed in the chat that I just want to bring up, and maybe I could have Lynette talk a little bit about this as people start to add their comments. I noticed that there's quite a few questions around supervisors indicating they may be concerned about talking about return to work with their employees. And Lynette, can you just go over how important it is to have those conversations early and in a safe way?
Sure thing, Shelley. I think that's probably something that is one of the top indicators that we have learned in all of the research that we have done, is the conversation and how the conversation proceeds is really important when it comes to reducing the complexity of a claim and to helping people move forward in a positive way. I think we heard that from what Dr. Kinley shared with us. I think Louise would probably also say that that is the case. But in a lot of the research we've done, when people talk about like what are some of the top indicators of what creates complexity, it is that relationship with the supervisor. Having a conversation about return to work in a positive way sets the stage for the belief that return to work can happen and will happen, and it just empowers people to move forward. So it's really, really important. The supervisor is one of the top strategic roles that can impact return to work. And I slow down and emphasize that because it is such a significant role. And if an employer were to say to me today, like, I can only do one thing, what should I do? It's really about investing with your supervisors on how they can be equipped to have those conversations in a way that is safe and it creates a culture that supports return to work for their employees.
Great. So we do have a few questions coming in to the chat now. Lee asks, will the workers be entitled to benefit of the doubt in entitlement decisions for gradual onset psychological injury? Lynette, maybe you want to address that one?
So benefit of the doubt really comes into play when everything else is equal. So what we know in gradual onset and the legislation that we have is that there needs to be an identifiable significant workplace stressor, and it needs to be the predominant cause. So it is a different bar than perhaps a sprain, strain, physical injury that there might be, like maybe someone reports that this happened and it's unable to be substantiated. So in gradual onset psychological injury, there is definitely an objective aspect. So it is not subjective only. There will be some subjective components to it, but it is an objective analysis that needs to demonstrate predominant significant workplace stressor. So it really depends on what you mean when you say benefit of the doubt. If there's a whole lot of information that is supporting objectively and subjectively what has happened, the benefit of the doubt can, if it's 50-50, benefit of the doubt goes with the worker. But before you get to that place, there is that objectiveness that needs to happen in this legislation. That is a really important thing for us to consider and to be reminded of.
Great. Marissa, I wanted to refer back to the scenario that you presented about Sarah. If the doctor's note says that the worker has to be off for 5 weeks, does an employer have to accept that, especially, you know, in terms of return to work? I mean, what can an employer do when they get a note like that? Lynette, maybe I'm thinking probably an answer for you, or even Louise, because this may be something you experienced, Louise.
Do you want to go ahead, Lynette?
I can speak to it from from our perspective, and then Louise, you can add to it. So a note saying off work doesn't remove the employer's ability to ask for information that supports it. So an employer can ask for what are the limitations or the restrictions that an individual has for which they are asking for this leave from work. Employers most times are not, they're not necessarily privy to what the diagnosis is, but it is not as simple as, well, they gave me a note that they're off work and the doctor said it, so I can't ask any questions. I would say that that is not accurate, that they can ask questions. They have a duty to accommodate workers, and in order to do that, they have the ability to understand what accommodation would be needed, and therefore they will need to ask questions in order to do that.
So Great. Just to add on to that, yeah, so one of the tools I think we sort of talked about, you know, understanding limitations and restrictions. And so how you gather that information without getting that diagnosis is understanding, really essentially help me understand why it is that you can't come to work right now. What does that look like, and what does that mean related to your job? Because I think that fit is really critical, because depending on what the demands are of the job, no different than those physical demands, thinking it back again to those cognitive demands. What does that mean? And does that mean that you can't be at work, or does that mean that you could be at work in some capacity? And as an employer looking for those opportunities to be able to offer that accommodation and those modified duties and modified work to help somebody return to work. So simply it's, you know, utilizing those resources to ask the questions, because we do have a duty to understand that a little bit more in order to fulfill our accommodation duties.
I have a question from Kim, curious about the gap time for claims adjudication for these claims. You know, certainly, you know, because currently it can take some time. You know, what happens to the worker? What happens to the employer? How are they affected from a cost perspective? Lynette, maybe you want to address that?
So that's definitely something that we heard when we first started down this path and spoke with other jurisdictions, like 7 other jurisdictions in the country already compensate for this type of psychological injury. And so there is definitely often a time delay from the first point of that claim coming in the door to WCB and being accepted. And that is really why we established a new service model. And that new service model being our client care navigators, who are involved even before the claim is accepted, trying to connect people to community resources that can help them from the mental health side of things, having conversations with employers about the accommodation options that they would have for them to help them stay at work or return to work if they're off. And so we're not waiting for a claim acceptance to start that conversation and to start that dialogue. And so we will be working actively with workers and employers to help them understand the process, what's going to happen, how we can connect them with resources, and how we can have very focused conversations. So in all of the training that we're doing, we have needs assessment built into every conversation. And that needs assessment will look at what are the needs of the claim, what are the support needs, and what are the return to work needs. And so we have built that into our process to really try and get to that place. There's nothing in the legislation that says you can't return to work until WCB determines if your claim is accepted or not. So we are going to really be focusing on those proactive conversations and trying to help shift how we think about return to work and abilities and preventing work disability in this province as we roll out this new area of work. And then we need to start applying that shift to all areas of our compensation system.
Excellent. Listen, I know that we have lots more questions in the chat. What I will say, we're not going to be able to get to all of them today. We do need to transition to the questions we received in advance from our partners at Aware Nova Scotia and their members from long-term care, home care, and disability support. So we'll do that now. What I will say to everybody who asked a question, thank you very, very much. We actually pull questions from the chats of our webinars to help inform the Q&A that's on our website. You'll find that on our corporate site. There's questions and answers there. There's some general questions that employers ask, questions that workers ask. I would encourage you to go to those links. I know they've been posted in the chat today, but we will use your questions to help inform those Q&As. So if we didn't get to your question today, don't despair. You will be able to find answers to the most common questions that we receive, including those that we've received today, on that Q&A in our website. So I'm just going to move along to the next segment, which is questions from employers in long-term care, home care, and disability support. Everybody is welcome to stay for this portion. We did, with great thanks to Don Pickering and the folks at Aware Nova Scotia, get some questions in advance, and we'll run through those now. And Lynette, I'm just going to turn it over to you. I think several of them are WCB focused, and if we have time after we run through these, we can take a few more from employers in that sector in the chat as well.
Okay, Denise, so I'll do my best to answer all these. So what mental health injuries does WCB cover, and how was the decision made to cover gradual onset psychological injury? So the decision to cover gradual onset psychological injury was when the legislation was tabled by government to include this as a part of coverage with the Workers' Compensation Board. Currently, prior to that, WCB did cover for psychological injury, but those that were traumatic in nature, and stress was excluded. Government changed the legislation, and so therefore WCB implements the legislative changes that government makes. And when it comes to the mental health injuries that WCB covers, under this legislation, it would be injuries that occur as a result of significant workplace stressors that have a DSM diagnosis, a mental health DSM diagnosis. So some examples could be anxiety, depression, are the two main ones that come to mind, but it's really anything that is in the DSM under mental health and that is diagnosed by a psychologist or psychiatrist as a result of the work significant stressor being the predominant cause. How long will it take for intake, assessment, and return to work after GPI? Well, as I said earlier, return to work after GPI, we're going to be starting those conversations from day one. So that is going to be dependent on the situation of the individual and the situation of the employer. Intake, we will be moving quickly on that. We have contracts set up for assessment to be completed within 14 days for diagnosis, if that's necessary to make a decision, with a service level a standard of 21 days to decision. But again, as I said, return to work conversations from day one. What legal obligations does the employer have under GPI compensability? The legal obligations of an employer, when it comes to the Act, are the same. They're no different from physical injuries or traumatic psychological injuries. It is whatever the Act says are the obligations, and gradual onset psychological injury would fall under that with all the same requirements and responsibilities. What benefits will be available, and is ongoing therapy or counseling included? So the benefits that flow from this would be the benefits, could be time loss, could be medical aid, and I do fully expect that therapy or treatment program would be a part of that. And what that looks like will be dependent upon the needs of the individual and how they fit into the treatment program that we have contracted for this area of our work. And can workers choose their own service providers? So WCB has entered into contracts with providers specific for this area of our work. If people come to us already with providers, we will have conversations with them about determining what is the best path forward and make a decision. But for the most part, we will be looking to use the contracted service providers that we have for this area of work to really focus on treatment in this area and return to work being incorporated into that. What happens if an employee can no longer do their job? Well, we would consider that the same as we would today for a physical injury. If an employee is no longer able to do their job because of their compensable injury, then we would go through the hierarchy of objectives that we have today when it comes to employment. And that is same job, same employer, similar job, same employer, different job, same employer. We would be looking for what are your reemployment obligations and what are you able to offer to that individual. And if we have to move outside of the same employer, then we would be looking at, can they do their same job with a different employer, a similar job with a different employer, or a different job with a different employer. So we would use the same process as we use today with determining the next steps for that individual. Does WCB have some messaging that employers can use to notify staff of the change so there's not a mass submission of WCB claims citing work burnout? We have lots of information on our website about questions that workers are asking and resources to the answers of those questions. We also had worker information sessions and a worker webinar. And I do believe that the webinar is available for workers to review as well. So you can encourage your employees to watch that and see the answers to some of the questions there. If they have a question as well, they can also, we can accept questions at our gpi@wcb.ns.ca email, but we encourage people to go to our website first to look at the questions and answers that we have identified there. When modified work is presented to an employee upon submission of a claim, is WCB going to take that into account when determining benefits? I.e., if the work is suitable and productive and the employee refuses, will WCB not support TERP? So one of the really important aspects of our client care navigator role is to really help workers and employers understand the process. And part of that understanding the process will be helping your employees know that when they submit a claim, the consequences of not accepting suitable and productive work, and that it might mean that they are not eligible for temporary earnings replacement benefits. So that's going to be really key information that our client care navigators will be sharing so that people are making informed decisions when they choose to participate or not to participate.
Great. Thank you very much, Lynette. We did get a few extra questions in the chat. I know we're a little bit over time, but we'll take a couple of them. In past sessions, we've been told that if if gradual onset psychological injury started at a previous employer, but then comes out under a new employer, the new employer is still paying the cost. Is this the case, or will the cost be split among old and new employers? And I feel like this is a great question for Kevin Foster, who has joined us on the Q&A panel.
Sure, I'll try my best to keep it simple because I think there's a lot of facts that would be important in that decision. But here's the simple answer. If there was no claim ever filed under the previous employer, just like any physical injury claim, the employer of where the accident happened and where the claim is filed is where the costs are going to get associated. But in saying that, there's a lot of factors that come into that. If there was already a previously claim filed under the previous employer, then we may be looking at a recurrence and putting it back on that previous employer. So simple answer is, if it's a net new filing of a claim, it's where the accident happens, the injury happens, and that's where the claim is going to get charged.
And I think, we have had a few sort of early on in the webinar, but in terms of new questions from our attendees in the long-term care, home care and disability support sector, I don't think I see any other questions. So with that, I think we're just a little bit over time, so we did fairly well on time today. I want to thank everybody very, very much for attending, for taking the time out of your day to join us for this webinar. I want to thank very much our presenters today. I will say that, as we've been posting in the chat all the way along, there's lots of great information out there in terms of the new prevention website, our new return to work tool, the information around readiness that you'll find on our website. We have an e-newsletter. We're doing direct mail. There are lots of ways to connect with the information you need to make your workplace psychologically safe and to support safe and timely return to work if a gradual onset psychological injury occurs. I want to thank you on behalf of the entire panel. We will have our next webinar on Wednesday, July 24th, so you can keep an eye on your email box for an invitation to that coming up next week. The focus is going to be on third-party verification, so sort of that claims adjudication process. So stay tuned for more information on that. But again, I'd like to thank you, and that brings our webinar to a close today.